Want to pass your CCRN exam? Then let's get started. Today we'll be covering 10 questions on the pulmonary system. Question 1. Which of the following is a characteristic feature of acute respiratory distress syndrome? Decreased pulmonary vascular resistance, hypoxemia that responds well to supplemental oxygen, decreased lung compliance, elevated arterial carbon dioxide levels. Pause the video and select your answer. If you chose option C, you are correct. Decreased lung compliance. ARDS is characterized by a significant decrease in lung compliance due to diffuse alveolar damage, leading to increased stiffness of the lungs and difficulty in oxygenation. Question 2. Which of the following is a hallmark sign of acute exacerbation of chronic obstructive pulmonary disease? Decreased expiratory wheezing, decreased sputum production, increased vital capacity, increased dyspnea, and productive cough. Pause the video and select your answer. If you chose option D, you are correct. Increased dyspnea and productive cough. Acute exacerbations of COPD are characterized by worsening dyspnea and increased sputum production, often accompanied by cough and wheezing. Question 3. Which medication is commonly administered via nebulization for the treatment of acute bronchospasm in patients with asthma or COPD exacerbations? Albuterol, atenolol, furosemide, nitroglycerin. Pause the video and select your answer. If you chose option A, you are correct. Albuterol. Albuterol, a beta-2 adrenergic agonist bronchodilator, is commonly administered via nebulization to relieve bronchospasm in asthma and COPD exacerbations. Question 4. What is the primary purpose of PEEP in mechanical ventilation for patients with ARDS? To reduce airway resistance, to decrease tidal volume, to improve oxygenation, to prevent barotrauma. Pause the video and select your answer. If you chose option C, you are correct. To improve oxygenation. PEEP is used in mechanical ventilation to maintain alveolar recruitment, increase functional residual capacity, and improve oxygenation by preventing alveolar collapse. Question 5. Which of the following pulmonary function test findings is consistent with restrictive lung disease? Decreased forced expiratory volume in 1 second, decreased total lung capacity, increased residual volume, increased FEV1 FVC ratio. Pause the video and select your answer. If you chose option B, you are correct. Decreased total lung capacity. Restrictive lung diseases are characterized by reduced lung volumes, including decreased total lung capacity due to impaired lung expansion or compliance. Question 6. Which is the most common cause of pneumonia in patients who are immunocompromised, such as those with HIV/AIDS or receiving chemotherapy? Streptococcus pneumoniae, Haemophilus influenza, Pseudomonas aeruginosa, Pneumocystitis jirovecii. Pause the video and select your answer. If you chose option D, you are correct. Pneumocystitis jirovecii pneumonia is a common opportunistic infection in immunocompromised patients, particularly those with HIV/AIDS or undergoing immunosuppressive therapy. Question 7. Which of the following is a potential complication of mechanical ventilation that may lead to barotrauma? Hypoxemia, hypercapnia, pneumothorax, atelectasis. Pause the video and select your answer. If you chose option C, you are correct. Pneumothorax. Barotrauma refers to lung injury caused by excessive pressure, which may lead to complications such as pneumothorax, air in the pleural space, particularly in patients receiving mechanical ventilation with high airway pressures. Question 8. Which of the following is a characteristic feature of ARDS? Increased lung compliance, hypoxemia that responds well to supplemental oxygen, normal or decreased pulmonary capillary wedge pressure, reduced alveolar arterial oxygen gradient. Pause the video and select your answer. If you chose option C, you are correct. Normal or decreased pulmonary capillary wedge pressure. ARDS is characterized by the diffuse alveolar damage, leading to increased pulmonary vascular permeability and non cardiogenic pulmonary edema, resulting in a normal or decreased pulmonary capillary wedge pressure. Question 9. Which of the following is a primary symptom of pulmonary embolism? Pleuritic chest pain, productive cough, wheezing, hemoptysis. Pause the video and select your answer. If you chose option A, you are correct. Pleuritic chest pain. Pleuritic chest pain, sharp or stabbing in nature and worsened by deep breathing or coughing, is a classic symptom of pulmonary embolism due to irritation of the pleura by the embolus. Question 10. Which of the following conditions is characterized by irreversible destruction of the alveolar walls, leading to enlarged air spaces and decreased gas exchange? Pulmonary fibrosis, bronchiectasis, emphysema, asthma. Pause the video and select your answer. If you chose option C, you are correct. Emphysema. Emphysema is a type of chronic obstructive pulmonary disease characterized by irreversible destruction of the alveolar walls, resulting in enlarged air spaces and decreased gas exchange surface area. Click that subscribe button and join us next Thursday.